Welcome back to Empowerment Nursing. I'm Linda and this is Ashley, and today we're going to talk about test questions with Empowerment Nursing, strategies for success.
So before we get started, just a couple things. If you'd like to follow us, if you're catching us on YouTube, please subscribe to this channel. We've published tons of videos on success strategies for the NCLEX, nclex-pn, as well as the CPNRE. If you're joining us on our Facebook page, you can click subscribe to our live video feed so you'll get a notification whenever we do go live, which is typically once or twice a week. You can join our Facebook page, which is N-Powerment nclex-pn test prep, where we publish blogs, very supportive community for test success, as well as test questions. And if you'd like to learn more about the Empowerment Nursing program and what we are, who we are, what we do, you can visit www.n-powermentnursing.com. So with all of that out of the way, let's get started.
Well, we're going to talk a little bit about Bloom's taxonomy. You may have studied Bloom's taxonomy in your program. It's very important when we think about Bloom's taxonomy in relation to NCLEX questions, because the NCLEX questions are written and coded according to one of the domains within Bloom's taxonomy. There are 3 domains. One is affective, one is psychomotor, and the third is the cognitive domain. And it is that domain that is important to us because the NCLEX questions, again, are written and coded according to the cognitive domain, and there are 6 levels to that domain. Today, what we're going to do is take you through each one of those 6 levels, progressing from the less complicated level to the most complicated level, and we're going to talk about each one of those levels according to a question. We're going to give an example of the question according to each one of those 6 levels of difficulty. And this is very important because it's important for you to recognize the difference between each one of those levels of difficulty, because that guides your studying. And you need to know what each level of difficulty, how it relates to a question, so you can pick out one of those questions and realize, aha, this relates to this kind of level of difficulty.
And a common question we get quite often about those preparing for the NCLEX and CPNRE, NCLEX especially, is what is the difference between a low-level question and a high-level question? Because it, of course, comes down to getting above that passing line. So we're hoping that this really demonstrates what that difference is. So we're going to start out with the very first level, which is knowledge level. So this is level 1 of 6. So knowledge level questions are your most basic type of question. Of course, you can't get above that passing line without getting through the knowledge level questions, because that's where you're going to start. Knowledge level questions are commonly recalling, listing, naming, recording, clustering, memorizing things, these type of questions. So we're going to give you an example of a knowledge level question. So here's a knowledge level question, the number 1 very basic level. From the list below, state the normal lab value for urine-specific gravity. And then, of course, you have options A, B, C, and D. The correct answer is A, 1.010 to 1.030. Options B, C, and D are not the correct lab value for urine-specific gravity. So basically, this is just memorizing one concept.
Right. And so how do you study for a knowledge level question? Well, in Empowerment Nursing, we have created this large stack of cue cards. And so one way of studying for knowledge retention on a knowledge level question is through memorization and recall using cue cards.
So a really good example of that is lab values, right? Nothing but memorization and recall. There's no application, there's no understanding, there's no none of that happening. So that's the very basic level of questions. The second level of questions is a comprehension level question. So we're going to take it one step up from the knowledge level. This includes questions that get at understanding, summarizing, explaining, and describing. An example of this would be, and we're going to carry the urine-specific gravity theme throughout. So an example of a comprehension level question would be, explain from the list below the purpose in obtaining the specific gravity value. And the options are A, to evaluate kidney function, B, to evaluate liver function, C, to evaluate heart function, or D, to evaluate lung function. Of course, if you're well versed in the content, you would know that specific gravity is a measurement of kidney function. So this isn't just asking you what is the normal specific gravity. This is asking you for knowledge above and beyond that in terms of comprehending what urine specific gravity measures. So it's one step up from that.
And how would you study that for comprehension? In N-Powerment Nursing, we use a lot of pictures. And to draw a picture of the kidney and to draw a picture of specific gravity, relating it to urine, is a way for you to recall and to integrate that knowledge in a comprehensive way.
We actually did a Facebook Live a couple weeks ago that you can probably catch on our Facebook page that gives you the picture of a stairway and talks about how concentration makes numbers climb in lab values and dilution brings numbers down. So that's an example of assisting and facilitating comprehension. We're moving on to the third level of questioning now, which is the application level of questions. And application questions get at applying, selecting, organizing, choosing, and demonstrating. An example of that would be, the patient you are caring for has diabetes insipidus. Interpret the specific gravity lab value below and select which lab value relates to this condition. So our options are A, 1.010, B, 1.020, C, 1.030, and D, 1.000. The correct answer, of course, is D, 1.000, but to get to that answer, you have to know a number of things. You have to know what the original question was, meaning what's the normal specific gravity. You have to know what diabetes insipidus is. You have to know the pathophysiology behind diabetes insipidus in that it increases urinary production. You have to know how that would alter chemistry in terms of the urine being very diluted. And then you would have to understand that the urine being diluted would decrease the urine-specific gravity. And then you have to go back to the question and recognize that it's asking you what an expected value would be, meaning the expected value would be lower than normal, making D the correct answer, 1.000. But you can see how already in the third level of application, we are starting to scaffold the levels of knowledge. We're getting progressively more difficult. We're getting higher above that passing line that everybody wants to get to.
Right. So how do you study for an application level kind of question? Well, in N-Powerment Nursing, we have devised this entire book that is filled with mind maps. And you can see then how you're able to put several levels of scaffolding knowledge together on one page. It gets at the many different components that are required in unpacking an application question. And this is why this book has been written in this manner.
Mm-hmm. So level number 4, we're not even at the highest level yet, and it's already starting to get complicated, right? Level 4 would be the analysis level question. So if you're getting questions at the analysis level, you are above the passing line, you could say. These are questions to celebrate. Analysis level questions get at analyzing, comparing and contrasting, classifying, mapping, dividing and choosing. So an example of an analysis level question would be this. The client with diabetes insipidus is about to be discharged. Which statement, if made by the client, demonstrates a need for further teaching? A, I am at risk of hyperglycemia. B, I am at risk of hypovolemic shock. C, I am at risk of hypoglycemia. Or D, I am at risk of having a myocardial infarction. So, the correct answer to that is obviously B, I am at risk of hypovolemic shock. However, to get to that correct answer, you have to know all of those things we just talked about in the last section. Then you also have to be aware of the side effects, the risks of that disease, meaning excessive urination, polyuria. urinating out all of our intravascular space, which we should understand we're losing volume, therefore losing pressure, therefore decreasing our perfusion to our tissues, therefore leading to a risk of hypovolemic shock. Not only do we have to understand that, we have to understand what are we going to teach the patient and which of these is demonstrating the need for further teaching. Right?
Right.
And we also need to know that diabetes insipidus has absolutely nothing to do with diabetes mellitus. So I don't know who decided to name that, but they would definitely be in the wrong.
Yeah, it's kind of misleading.
It's kind of misleading a little bit.
So how do you study for analysis level questions? Well, you study for analysis level questions in all of the methods we've already described, right? Because we're building in our capacity of critical thinking. And also another way that Empowerment Nursing has devised to assist you in being able to analyze analysis style questions are side-by-sides. So throughout this book, there are side-by-sides that are there for this exact purpose. When you have two similar concepts that are side-by-side, it leads to deeper level retention of knowledge, memory retention. When you compare two similar concepts, you get to know both of them more deeply because you're comparing them. So in this manner, Empowerment Nursing has gotten at this deep level of the Bloom's domain, this analysis type of question through side-by-sides.
The next level is level number 5, which is synthesis. Synthesis is very close to analysis and kind of getting at the same thing. An example of a synthesis question would be, the patient has been diagnosed with diabetes insipidus. Which intervention below in the nurse's plan of care would you question? So the main difference here is that now we're getting at nursing judgment. Now we're questioning things. The options are A, monitor intake and output, B, obtain daily weights, C, monitor specific gravity, and D, monitor glucose. So again, going back to the question, which intervention would the nurse question? That means one of those things is incorrect. Of course, the incorrect answer is monitoring glucose levels because diabetes insipidus has nothing to do with blood glucose. However, to come up with one wrong answer, you have to know all of the right answers. So you have to be able to rule out, yes, you would monitor intake and output. Yes, you would want to get daily weights. Yes, you would monitor specific gravity. If monitoring for the risks of hypovolemic shock there, yes, you would do that as well. You wouldn't monitor glucose level, however, and you would question that because that has nothing to do with diabetes insipidus.
How do you study for synthesis level questions? Again, we're getting to these higher level questions. Everything we've already spoke to gets at this synthesis level. So the mind maps, the side-by-sides, the cue cards, the picture drawing. But also in Empowerment Nursing, we have a web-based element to our program. So you're able to watch us in the comfort of your own space. You're able to stop us. You're able to verbalize what you think we're about to say. You're able to then play and have feedback with us in the same room and watch that over and over and over again, which helps you to synthesize the knowledge within this book.
And we do teach this entire textbook. There's a video web library in which every chapter is taught and matches up to a chapter in the video web library to the textbook. So the very last level of questions, the most difficult level of question, is level number 6, and that is evaluation. This asks the nursing graduate to evaluate, argue, judge, persuade, and recommend. So this is getting down to critical thinking and critical judgment. So here's an example of a question that is the evaluation level. Which answer below indicates that the client with diabetes insipidus understands how to manage their care? A, the client will maintain normal fluid and electrolyte balances. B, the client will select a diabetic diet. C, the client will state dietary restrictions. And D, the client will exhibit a normal serum glucose level within the normal range. Of course, the correct answer is A, the client will maintain normal fluid and electrolyte balance. So now we are asking for you to evaluate something. So you're evaluating the client's understanding of something. So this is the highest level question. This is a very high level question. Of course, we could get into select all that can apply questions, which are a combination of synthesis and evaluation, because you have to know everything about a concept, and then you have to be able to evaluate it as well. So I hope we've managed to demonstrate how these levels become progressively more difficult in utilizing the same concept. And what we're getting at is that it's not enough just to stop here. I mean, these cue cards do have basically everything that would require a memorization component, but this is only going to get you a past, up to that passing line. It's not going to take you above that. Students that just memorize cannot synthesize. So if you were the student that got by in nursing just memorizing, you're going to have no ability to synthesize that information on NCLEX style questions especially. And that's where you need something like this that's going to take you through those higher level questions and give you the actual critical understanding of that content to enable you to then apply it to NCLEX style questions.
So it's very key when you choose an NCLEX resource that they use the study strategies that get at how to answer these different levels of increasing complexity within the questions. And Empowerment Nursing does that purposefully for you.
So stop memorizing and start synthesizing, and we can do that. We've done that for you. We've done all of the work for you. All you have to do is join us.
Don't give up.